This is Dr. Neeraj Gupta from Sir Gangaram Hospital, Delhi. I am working here as a chief allergist and senior pediatrician at the hospital. Today we will be talking about seasonal allergies. First of all, let us understand what is allergy. So whenever an external environmental substance like a dust or a pollen or a fungal spore comes in contact with our body, then at that time these are considered as harmless and our body do not react. But in an allergic individual, the body considers them as harmful and start producing certain antibodies to fight against these external substances. And it is the result of this fight that there are certain symptoms which are produced and that causes allergy. It all depends upon that which particular type of external agents are coming and what is the route of exposure. Suppose if the external agent is coming from the inhaled route, they are entering through the nose, then at that time there could be some symptoms which could be related to nose, like sneezing, running nose, blocked nose, or a child or an adult will feel that there is something sticky which is there in the throat, or each and every time the sputum or the mucus is coming inside the throat and he has to clear it, or sometimes there is some snoring or the loud sound which is produced during the time of sleeping. And similarly, if the same substance goes inside the chest, then at that time the breathing tubes get choked. And when the breathing tubes get choked, then at that time there is a reduction in the airflow, reduction in the oxygen supply to the lungs, and hence there is coughing which is produced. So the child or a patient or an adult will come up with that he is having some coughing, he is having some breathing difficulty, he is having some audible whistling sounds which are coming from the chest, or he might be experiencing respiratory problems, breathing problems after exercise. He cannot play with the peer groups. He cannot do that much exercise, that much work as the peer groups can do. Similarly, if the external substance is in the form of a food and the food is ingested, then at that time the symptoms could be abdominal pain, loose stools, vomiting. It can even come up with some body rashes like eczema. It can even come up like itchy rashes like urticaria. It can also present with some swelling of the lips, which is also called as angioedema. And sometimes it can be life-threatening, in which a person's blood pressure can drop significantly, person can go into a severe respiratory failure, person can even go into, you can say like a diffuse hives, which can happen. And these all things can cause life-threatening problems. So thereafter, we need to really understand that what allergy is. And now, it all depends upon that to which external agent our body is reacting. If these external agents are present around the clock during the year, then they will be called as perennial allergens. So the perennial allergens could be like some animal denders like cat dander, dog dander, or these allergens could be even some bird denders also, which are considered as pets at home. Or these allergens even can be certain fungi, certain cockroaches, even dust mite. Dust mite are tiny particles, tiny insects which are there inside our beddings, mattresses, and they all can cause these type of allergies. And then if there is some allergen which is coming in a particular season, like changing weather, these are usually the pollens, usually the fungal spores. So they come up in a particular season and then they drop down. So this is like during the changing weather, then at that time the person will come up with these type of problems. So we need to really understand what allergy is, what are the triggering factors for a particular person for the symptoms, and then thereafter we have to go to an allergy specialist, get the allergy testing done. By these tests we actually come to know that okay, by which thing our body is reacting to, so that we can adequately plan for the avoidance measures, preventive measures, and simultaneously some of these allergens can be treated with special treatment called immunotherapy. So these all things are really important. So with this, I will say thank you to you.